Good evening, everyone. Welcome to the fifth and final evening of our Nurses Immunity Boost Challenge. We've had a wonderful time these last few days, and I hope you've enjoyed our presentations. So I'm Dr. Charmaine Blake Woode of Diabetes and Endocrine Wellness Center and the Lighter Way. And together with my husband, some amazing guest speakers and presenters, and our team behind the scenes, we have partnered to bring you this challenge. Our goal in bringing this challenge, we targeted nurses because in 2020, the year of the nurse, we wanted to celebrate nurses. We wanted to honor your commitment and your sacrifice. Some of you have, or some nurses have given the ultimate sacrifice, and that of their lives on the front lines during this COVID-19 pandemic. We wanted to provide valuable information that will help you as you serve your patients. Not only that, but to help you safeguard your own health, your own well-being, your own life during the time of this pandemic. Now, we do recognize that nurses can't do this work by themselves. They do have some help in the form of CNAs and health techs. So we want to recognize the help that the nurses get in the form of CNAs and health techs and other healthcare workers as well. So if you are in our viewing audience and you are a nurse or a healthcare worker, identify yourself. Let us recognize you. Let us celebrate you. Go ahead and put nurse or healthcare worker in the chat. And I'm looking to see. All right. Go ahead and just identify yourself by putting either nurse or healthcare worker in the chat, okay? So over the last 4 evenings, we've had some power-packed presentations, lots of valuable information that certainly I will put into use, and I hope you will commit to putting some of this information into action as well. What good is information if we don't act on it? So I do want to know, though, how many of you have been here for the prior 4 days? Go ahead and put that in the chat as well. If you were here Wednesday night, Thursday night, Friday night, Saturday night, put that in the chat so I can know if our audience that's viewing tonight, if we're just first-time attendees, or if you are repeat attendees during this challenge. So put that in the chat for me. Now, if you've missed any of the previous evenings, you can go to our Facebook page. It's Team Destiny Events on Facebook. That's Team Destiny Events on Facebook, and catch the prior videos. Remember to share the information. Even though we're targeting and celebrating nurses, this information is applicable to everyone. So share the information, and remember what our hashtags are. The hashtags are Team Destiny Events, Immunity Boost, and Year of the Nurse. So we have had several speakers over the past few days. Each of them has shared from their expertise, from their experience, and also from their own perspective. So remember, our challenge is to provide information, and you get to decide how you act on the information presented. We want you to make informed decisions. We want to safeguard your health, the health of our frontline workers in particular, but everyone, particularly during this pandemic. And we hope and pray that the information we've provided has been helpful as you make decisions about how you're going to navigate the world during this pandemic. So last night, can we talk about last night? Last night was phenomenal. Dr. Milton Brown was absolutely phenomenal. He shared from his heart. You could hear his concern as he spoke. And there were several things that he wanted us to walk away understanding as a result of his presentation. He wanted us to understand that what we have now from Pfizer and Moderna are vaccine candidates. Because of the vaccine approval process, what's being offered now has not gone through all of the different phases. And so therefore, we are being offered a vaccine candidate. So he made that point several times. The other things he mentioned was that the vaccine candidates do not prevent you from getting COVID-19. They also do not prevent you from spreading COVID-19 should you contract it. He said you still need to continue wearing a mask, still need to continue with the personal protective habits that you've developed over the last several months, personal and public health protective habits, wearing a mask, social distancing, being sure to wash your hands. He also said that currently we do not have good information, or we do not have all of the information to know exactly how long the immunity imparted by the vaccine lasts. And he mentioned specifically, we didn't know if it's going to last more than 3 months. He also said that if you have an allergy to any foods or medications, where you are at risk for anaphylaxis, that means breathing trouble and other organ dysfunction as a result of an allergic reaction, or if your doctor has prescribed you an EpiPen, you should not take either of the vaccine candidates that have been authorized for emergency use. So I thought that information was extremely valuable, and I just wanted to recap in case you missed that presentation last evening. Remember, you can go back to the Facebook page, and that's Team Destiny Events, and view that presentation and the rest of the presentations that we've had from earlier in the week. And also, don't keep the information to yourself. Please share it with your friends, family, particularly share it with our nurses and healthcare workers. So as we wrap up our challenge tonight, we're going to have an amazing time. We've assembled a panel of nurses who are going to share of their experiences during our COVID-19 pandemic. We want to make sure that we are, as we're honoring the nurses, that we hear from them. And we've assembled a panel of several nurses that we're going to hear from tonight. Now, as we about to get into our presentation, or to hear what our panelists are going to share with us, please go ahead and share the video so that your friends and family can join us. Remember, you want to share using the hashtags Team Destiny Events, Year of the Nurse, and Immunity Boost. So take a few seconds and share. So I see we've got a few people who were here for all 4 nights. Thank you for your support, and thank you for sharing our event. So if you're ready to get started, go ahead and put ready in the comments. I want to see you put ready in the comments. You can put ready, or you can put let's go. Go ahead and put that in the comments. So there you go. So that I know you're ready to hear from our panel at this time. Okay, that's wonderful. So we've got several panelists that we want to hear from at this time, and we're going to bring them on. I'm going to share a brief introduction of each of them. We have Ms. Jodelle Callens, who is an LPN. She served as an LPN for the past 7 years, and she comes to us from Birmingham, Alabama. Jodelle, welcome. All right, while we're waiting for Jodelle to come on the screen, we have Dr. Sheila Davis, who has had an extensive, there we go, Dr. Davis, welcome, who has had an extensive career, over 40 years in nursing as a nursing professor, researcher, and administrator. So Dr. Davis obtained her bachelor's in nursing from University of Alabama in Huntsville and her master's in nursing in cardiovascular nursing from UAB. She obtained the PhD in nursing education from Georgia State University. She is a family nurse practitioner, and she practices at the Natural Way Health Clinic in Byram, Mississippi. So welcome, welcome, Dr. Davis. Thank you for joining us.
My pleasure.
We also have with us this evening Nurse Ruth Boucher. And Nurse Boucher has spent decades in nursing. She's also known as the running nurse. She has been a travel nurse at various U.S. institutions. She is a former lecturer at Fiji University School of Nursing. Ruth, are you there? All right. I know Ruth was having some technical difficulties coming on, so hopefully she'll be able to join us soon. All right. We have Mr. Randy Ryan, who is an open surgical ICU nurse, and ICU nurse practitioner, and he practices at Maimonides Medical Center in Brooklyn, New York. Welcome, Mr. Ryan. Thank you for joining us.
Good night. Good night.
All right. So, Dr. Newton is joining us as well. Dr. Newton, thank you for joining us. I know you're just getting off, so thank you for being with us this evening. Dr. Newton has an impressive resume, to say the least. Dr. Newton is a former RN. Am I saying that correctly? Is it former?
I will always be a nurse.
Nursing is close to your heart. I hear you. I hear you. But he is an RN, an MD, and a PhD. He has over 20 years of clinical experience. He has been a recipient of the U.S. Presidential Achievement Award for outstanding public service from President Obama. So we want to welcome our panelists at this time. We are going to just allow each panelist to just share just for a couple of minutes each. We'll start with you, Dr. Davis. Just if you would share with the listening audience some of your experience with COVID-19 patients. Tell us what has impacted your practice during this time of COVID-19. Any particular experience that stands out to you? I know sometimes when we serve, um, we a lot of times go into it feeling that we're bringing something to our patients. A lot of times they actually impact us quite a bit. So if you have any of those standout experiences, feel free to share those with us. I know, Dr. Davis, you have a special interest in what we can do to boost our immune system. So I'll just let you share for a few minutes.
Okay. Thank you. My husband and I have a small clinic in Mississippi. I'm hearing feedback. Can you hear me okay?
I can hear you.
Okay. And I practice lifestyle medicine. And for me, I always look at what we can do to be proactive. I am pleased to say we've not lost any patients through the clinic. Right at the onset of this thing, I produced a newsletter on boosting your immune system, and we distributed that to all of our patients. And then we distributed that far and wide. And those who tested positive, I'm just so pleased about this. They implemented those procedures that we had outlined, and everyone has done well. So I thank God for that. And that's what I'd like to share tonight, some of those practices.
Okay, all right. Dr. Davis, go ahead and just take a few minutes now and share some of those practices with the audience.
Okay. I became board certified in lifestyle medicine from the American College of Lifestyle Medicine. So the whole focus of our practice is lifestyle. In addition to that, I had the opportunity to do I call it an internship at Wildwood Lifestyle Center. And there I was first introduced into the power of lifestyle. There I saw people's cholesterol levels drop 100 points in a week, that sort of stuff, on a whole food plant-based diet and other things. So I brought that into our practice. And if you'd like, I just share some of the things that I admonish all patients to do, not just patients who may be at risk for COVID. If anyone comes into the practice, and we have a number of resources that we have, but we challenge all patients, regardless of the condition, to go on a whole food, plant-based diet. We know that whole food, plant-based is a low inflammatory diet. And when we look at COVID, we want to look at all things to reduce the inflammation, the inflammatory load. So everybody goes on that. Well, not everybody, but we certainly challenge most people to do that. Another thing is the reduction of the refined sugars. And just recently, I've been doing some research and found that just a very strong correlation between refined sugars, especially a high fructose corn syrup. And we know that high fructose corn syrup is in almost everything that's processed. So, we really challenge people to do that. And then, that whole thing about vitamin D, I'll speak about later, but I do know, I've seen in the literature that high fructose corn syrup minimizes or reduces our vitamin D levels. And for those of us who are brown like me, we already have a problem in that area. And when we eat things that are inflammatory, it just confounds that problem. We challenge people to drink adequate water, and that amount differs for each individual, at least until your urine is pale, unless you're on any medications that would color that urine. We also talk about hydrotherapy for the people who have developed COVID. One of the first things we ask that they do is to engage in hydrotherapy treatments, the hot and cold contrast showers, in that we ask them to do 3 minutes hot safely as you can tolerate that, followed by 30 seconds of cold as you can tolerate that. And we know that that brings that heightens the immune response. And that's excellent to do in doing this first phase of COVID. Sleep is very important. If you were to look at the information, the early information that comes from the Adventist health centers or sanitariums that operated during the 1918 influenza pandemic, you're looking at those data, you'll see that those sanitariums did exceptionally well compared with the more public institutions as it relates to longevity, as it relates to recovery from the flu. In fact, if you go into the old newsreels, you'll see commendations from governments and from city governments commenting them. And one thing that comes out very clear across all of those sanitariums was the use of hydrotherapy, that hot and cold contrast showers. And there have been a number of recent or more modern studies to validate the efficacy of that. Along with that is adequate sleep, at least 7 to 8 hours of sleep. They found that to be very restorative. Your nervous system is restored, and other organs and pathways and processes in your body are restored with adequate sleep. Sunlight, we know that we get the vitamin D from sunlight, but this is the winter time now, and those of us who are darker don't absorb it as much. But along with sunlight, I'm going to say vitamin D. We check vitamin D levels on everyone, and if they're deficient, we take measures to remedy that. Processed foods, reducing processed foods, making your food count. If you're going to eat good, eat whole food. And last, stress. And people do a lot of things to reduce stress, and whatever works for you, do that. But as a Christian, I share with them some of my stress reduction mechanisms, and that is going to the Lord. I'm glad I know the Lord as my stress reducer, and not everyone I know has the same belief system, but I share mine, and whatever works for them, I ask them to engage in that. So those are some of the basic lifestyle practices that we share with patients, all patients, but particularly those who are challenged.
Okay, good. Now you mentioned the vitamin D. Did you have any more to say about that? A couple of our speakers earlier in the week mentioned the vitamin D and the importance of that. Our immunologist mentioned the fact that, one of the studies, well, at least one of the studies showed that vitamin D significantly, that patients who had COVID and had adequate levels of vitamin D, they were able to show that there was less mortality.
Yes, there is a 2020 study that comes out of the journal Nutrient, and it's by Dr. Grant. And it shows that vitamin D can reduce the risk of infection, but it also lowers our viral replication load. Vitamin D does. It decreases and I'm reading from this, it decreases the concentration of pro-inflammatory cytokines. And in phase 3 of COVID, it's that third phase of the cytokine storm that takes people out. But adequate levels of vitamin D are deemed to be able to reduce that risk. And also for pneumonia, it contributes. Let's see. The suggestion in that particular article is if you know that you're deficient, to arm up with about 10,000 IUs every day for a couple of weeks or so, and then let that moderate down to maybe 4,000 units once you know your levels. So we ask everyone to please look at their vitamin D levels and make sure that they are optimized as they go to fight this virus. And I have other studies too, but I'll take a break and let someone else speak. I'll
Okay.
come back.
Sure. And if there if there are any audience questions specifically related to vitamin D, we'll have you respond to those. If
Well,
that
I'm sure others have information too, but I have just been intrigued by it.
Okay, okay. All right. So I do see someone in the chat mention hydrotherapy. So that's what you were
Yes.
talking about, the
Oh,
uh,
yes.
hot and cold
Yes.
showers. Okay,
Hmm.
awesome, awesome. All right. So the next on my screen is Mr. Ryan. So Mr. Ryan, as an ICU nurse, nurse practitioner, as a open surgical ICU nurse practitioner, you see the sickest COVID patients. Um,
Right.
so tell me some of what you've experienced during this COVID pandemic. What's different during COVID versus pre-COVID? What differences are you seeing in terms of the care that you're providing to your patients? Give us some insights into how sick these patients really are. A lot of people still don't believe that this is a real thing. At least by their behavior, they don't show that they believe that. So if you could just share with us some of what you're seeing, that would be helpful to some of those in the audience who maybe aren't convinced that they need to do all the things we've been advising them to do.
Got it. So first of all, I'm an open heart surgical ICU nurse practitioner or cardiothoracic ICU nurse practitioner. I'm a hospice NP as well, and I'm a professor at City Tech in New York City in Brooklyn. One of the things that I could say, first of all, that goes along with everything that you guys have been saying, is that there's this consensus that, well, if I'm healthy, I don't have to go with all of the safety protocols that everyone has been talking about, like wearing your mask, keeping your safe distances, keeping your doctor's appointments, caring for your immunity, and doing therapeutic lifestyle changes and things like that. A lot of people who think on this level are wrong. As the doctors can back me up on this, there's something in the hospital called incidental findings. It means that you have an illness that you or no one else knew about until something else happened. So you may have that patient who needs to have hip surgery, and when they were working them up for the hip surgery, they found out they had uh, some sort of cancer, or they had heart disease, and now they need cardiac surgery and hip surgery. So the same thing goes along with COVID virus. If you have an illness that's undiscovered, when you get to the hospital with the virus is actually going to take advantage of that illness, and it's going to exploit it, and you're going to be a lot sicker, and you would have just found out that you have this illness. So taking care of yourself, keeping doctor's appointments, taking care of your immunity, all of these things you must do, because no one's a fortune teller, and you don't know what you have until we find it. That's the first thing I would say. Um, before the before the virus hit, it seemed like when a patient came in and had a stroke symptom, that patient was a stroke patient. If they had a cardiac symptom, they were a cardiac patient. If they had asthma, whatever it was, we could categorize them. Once the virus hit, they were all one person. They were all one illness. People were, like I'll tell you, my coworker who's a nurse I was working with, her mother went into respiratory failure, was taken to the hospital. We transferred her to our hospital where myself and our team was caring for her. And the next day, her father cardiac arrested and died in the home. Wasn't categorized as a COVID illness. He just died. But that was the clotting from the COVID virus that caused him an MI. And you know, it seemed like everyone was having all of these illnesses that we used to separate into different um, illnesses and different specialties, all being the COVID virus. So someone's coming in with the stroke, they're actually COVID when you test them. They stroked because they were positive COVID and the clotting and things like that. Um, when you looked in the ICU, first of all, my open heart ICU, where I worked with our team, we had to close it down and turn it into a ICU called ICU X, which was all COVID, and they were like the worst of the worst COVID patients. So I do a procedure called ECMO on the worst of the worst patients, and those it's a procedure that if your ventilator can't oxygenate the patient, if they meet a certain criteria before they expire, let's try this. And what I can tell you is most of my patients who were on ECMO were in their 30s, like young 30s, 30 to 35, which goes against what you hear on the news. And we've had some successes, we've had some failures in that, but when you looked at our population, they didn't resemble a lot of the things that you hear in the news. Young people are getting sick with the virus just as much, it looked like to me, and they were succumbing just as much to the illness. In the ICU, it looked like everyone went to a large wedding, ate the food, all got poisoned with the same bad food, and now they look like they all have very similar symptoms. And you had this feeling of inadequacy when you first saw what was going on. You felt like you were inadequate, and then the next day you felt like, you know what, they're all they're all we're all that they have, and so we have to come in and do 1,000% and just go at it, even though the patients many times weren't responding appropriately to everything that you did. Um, so that was very, it was devastating for the team that I work with, and the families as well, who, they couldn't come to the hospital and see their family members. We had to actually have them do things like FaceTime and WhatsApp to actually see their family members. But one thing that always sticks with me, one experience that I had and went to wrap up, that it sticks with me all the time about being in the ICU, was one night I had a Middle Eastern gentleman come to the ICU, and he was on his cell phone and he was talking, and he looked just like a regular person. He didn't look like he was that sick. And the nurse went in and she drew his blood. And as soon as we sent that blood to the lab, all of his bloods clotted and the lab couldn't process them. And because he was so alert and so outspoken, the nurse was intimidated to go back in the room and ask him if she can draw those bloods again. So she came to me and she asked me to do it. And I went into the room and I explained to him that his bloods clotted and I needed to draw his bloods again. And he did exactly what the nurse thought he was going to do. He started to argue with me. How many times are you going to draw my blood in one hospital? And he just went on and on and on. And I sat there and I listened to him. And then at a certain point, I stopped him and I said, sir, you have the COVID virus and you can die right here. I need you to do everything that I say because I would like to get you back home to your family. And he stopped and he looked at me and I said, do you have children? He said, I have 5 children. I said, listen, I need to get you back home to those 5 children. This is very serious. And with that, he just stuck his arm out, gave me his arm. He allowed me to draw his blood. And when I was done drawing his blood, he looked at me and he said, thank you, brother. Thank you, brother. Thank you, brother. He said it like 3 times. And when we come in the ICU to get reports every shift, you get report and there's a sort of list of patients who they don't think are going to make it. And the next day that I came in, and they gave me a report, and then they started to go over that list of patients that they didn't think were going to make it through the night. His name was on it. And I was blown away. I'm like, how come? This guy was great. What do you mean? It must be a different person. And they were like, no, we had to intubate him. He's not doing well. And he's not, he probably won't live throughout the night. And, it always stuck with me that how quickly things can change from moment to moment in the hospital with the COVID virus patients. The patients that you think are doing great can just code on you, go into asystole and code on you, and you're left wondering what happened. And then there are patients who aren't doing great, and very, very seldom turn around. But the ones who you never expected, when they go, it's very strange. And I always remember in my head him thanking me and calling me brother. And it's every day that I discuss the COVID virus with my coworkers, he always comes to mind. Just the last things he said to me was "Thank you, brother," and it was just awful how things progressed. But I'm sure the other nurses and doctors have experiences similar to mine, and I'd like to give them the floor to speak about it.
Okay, thank you for sharing that with us. I can see why that comes to your mind almost on a daily basis. It's very sobering to hear, someone who was full of strength and vigor enough to argue and put up with a fight, that in a short period of time, he's, on a ventilator,
Right.
fighting for his life. Very,
and then passed on. Yeah.
And passed on. Yes. Yeah. Very sobering. All right. Well, thank you for sharing that. Dr. Newton, if we could hear from you at this time. Know you're extremely busy. You're up in that area as well that was hit so hard by the pandemic, back in the spring. So if you could just share with us some of your experiences, something that lets you know beyond a shadow of a doubt that this thing is real, and we all need to take steps to safeguard our health. I'm sure the audience will be appreciative.
Thank you, my dear sister, and thank you for having me. Before I even continue, let me greet the esteemed panelists, and of course, my professor, my mentor, my friend, Dr. Davis. She was one of my nursing professors. So, Doc, I hope I have represented your pedagogy at its highest. And thank you for everything you deposited into me. I have never forgotten you, have loved you ever since I met you. And I just want to say thank you. We were at Oakwood together, and she impacted my life so great. And so I'm so honored to sit on the panel with you, Doc. It's good to see you. And congratulations on the work that you were doing. And listen, I must say, from my experience, it was it was an eye-opener for us. And I prepared about 7 S's to share to keep our immune system elevated. We know at its optimum, we know that the virus is not a living particle. It is like a seed. And I want us to think about it in terms of it being a seed. A seed in your hand doesn't grow. But if you put the seed in the right environment, it bursts into life. And the virus hijacks the resources of the cell and replicates itself. And if it can replicate faster than your body is able to hold it at bay, then we have problems. What I saw, and some of the things that I brought to share with you, I see Doc already shared a lot of them, so I do not want to be repetitive. But I started with spirituality as one of the S's, and because I believe spirituality is the lens through which we will interpret life. It allows us to mitigate how we deal with stress. And the other one was sleep, 6 to 8 hours of sleep at a minimum. It is a requirement sleep for the human body. What we know is that if you have at least 7 to 21 days of bad sleeping habits, 700 base pairs of your DNA go rogue on you and turn to cancer and cancerous and inflammation, which we know inflammation is the seat of all illness. Okay, and the other S is stress. How we deal with stress. Stress diminishes the immune system to 30%. This virus is opportunistic. If your immune system is in check, you are going to be able to deal with it. That is the ideal. If you are immunocompromised, if you have the foundations for and the ingredients for inflammation, you're going to get sick. And that is why a lot of our people, and I speak now, when I say our people, I speak of the African peoples in this country. A lot of them, 3 to 1, compared to their Caucasian counterparts, came down with this infection at its worst. And we know part of it was related to not only the comorbidities, but the diet. And Doc touched on it. The refined foods, the use of high fructose corn syrup, the use of dairy products, which is a very dangerous product for Black people to use, because not only do we not have the enzyme to process it, it creates inflammation. And we know that dairy also influences the development of diabetes, especially in Black peoples. And of almost all my patients who are diabetics come from a history of dairy consumption. And so we try to get them off of that. Sugar, another S is sugar. Sugar decreases the immune system to at least 30% and holds it there for 3 days at a time. And remember, we said this viral particle is opportunistic. If you are living off of 30% of your immune system, you're always at a disadvantage. Salt, of course, we know that it's bad, especially for Black people, because our kidneys tend to hold on to salt longer than other ethnic groups, which salt causes the body to hold on to water, which increases the volume, which increases the pressure. And a lot of our people suffer from high blood pressure, which is a comorbidity, because that pressure through and Doc, I know you're going to appreciate that, because you taught us this cardiology. That type of pressure in vessels causes inflammation and swelling in the intimal layers of the arteries, and so this even predisposes us. And another one, and Doc, you already touched on this, is sunlight. Another S is sunlight. We know 5 to 10,000 IUs of vitamin D daily is necessary. And vitamin D helps to mitigate the inflammatory response. It boosts the immune system. We spoke of saturation. By saturation, I mean water. The most accurate replacement formula for water is half your body weight in ounces. So let us suppose you're 50 pounds, you should be at a minimum drinking 25 ounces of water. And for those of you who are athletic and who are in the gyms and working out even more, you have to add a little bit more to that. Doc, I see you sipping on some water there. This is what I'm talking about. And then, of course, the doc spoke of the showers. And by shower, I mean, as what she said, you use 3 minutes of as hot as you can tolerate it, followed by at least 30 seconds to 45 seconds of as cold as you can tolerate it, because that causes the body to produce healthy immune system boosts. What I notice here, to speak to the question even more closely, I was in the inner city. A lot of my patients, every Black person who comes before me, and I do it for all patients, but especially Black people, I get their vitamin D levels. And you would be surprised. 90% of our people are vitamin D deficient. And at first I noticed this trend, and I noticed a correlation with a lot of inflammatory diseases, a lot of diabetes, high blood pressure, infections. And I realized, and that is really what I did my my dissertation in. And then I bumped into the science of biophotonics, and I realized the correlation. So a lot of my patients, although they caught the virus, a lot of them did not decline. I had a dear friend of mine who was a diabetic, had high blood pressure. He worked in the prison system, because a lot of the folks who worked in the prison were sick, and most of them are our people, and he is now on hemodialysis. When he came down with the virus, none of the emergency rooms in the city would take him. And he had to call his daughter, who took him to Connecticut. And it was when he was there, they said it was a good thing he came in, because he had progressed so terribly that his kidneys were destroyed. He was on hemodialysis. And could you believe that he was asked to return to work? I had other patients who were known as essential workers. And these guys work for the public transportation system. And one patient of mine said, "Listen, I need a note because they don't." And these are some of the realities our people had to deal with, and this was so heart wrenching. They had them working in the subway in groups of 4 to 6. And my patient said to me, a brother, of course, I realized that I couldn't see a couple of my buddies. They were not coming to work anymore. And so he called one of them and said, "Why aren't you coming to work?" He said, "Man, you don't know. I have COVID. The other 2 guys died. And I caught it, and they were in a group of 6. And my patient said, "But how is it nobody told me this?" And he said that we were told not to tell any of you. So here these guys working together in close proximity have the infection, and they're told not to tell each other. And a couple of them died. And there was one who had gotten critically ill when my patient reached out to him. And so he's asking can I get a letter to say that I could be out of work? And these are some of the situations we are confronted with. People are afraid, and our people who are supposed to be labeled the essential workers are the ones who are put in these positions where they are going to be brought into close contact with this virus. And a lot of them were ravaged by this. I mean, there were so many deaths up here. And even in the church setting, we couldn't even perform funeral services for some of the people. I mean, it was a terrible thing. And so what we do, and I do not know how many of us here are of the Christian faith, but the Seventh-day Adventists have a New Start program. We have a diet and lifestyle that we practice. And like Dr. Davis said, we have been pushing this on our patients. And I have done that. I have had patients come into my office with 10, 15 medications. And I say to them, "Listen to me, I am going to cut you off of this. Too many medications." And a lot of them are just control mechanisms, nothing that leads towards curative measures. And so as healthcare professionals, and I speak now to within the context of nursing, nurses, like Dr. Davis would always say when we were nursing students, your first role is education, education, education. We teach preventative measures. We teach prevention. We teach lifestyle, because lifestyle and diet are curative measures. When you get to pills, they are control mechanisms. And so we want to empower our patients with the curative measures. And so right now, even now, I work at some of the COVID centers, some in Staten Island and in Brooklyn, and we are seeing the cases on the increase. The infectious rates, the positive results are increasing now, and there was a wave of panic and hysteria and fear, and we are seeing this pandemic evoke certain other dysfunctions, anxiety, depression. People are really having a difficult time. I mean, the fear factor, we can't, the amount of anti-anxiety, the amount of sleep medication, it is remarkable. And we're here having to educate our patients. And what I see, though, and I will close on this, what I see is that too many times our people who are poor, people who are of African and Latino orientations, ethnicities, are most often not given the best of care because they're taken for granted, they're disrespected, and their humanity is not reinforced. So when they meet us, and I'm so happy that my brother because who just spoke before me, he had that experience where sometimes our people are labeled as difficult patients, as difficult people, but when we go to them with a touch of humanity, and the brother was able to break down that sometimes those barriers are erected because of fear. They are erected because our people have, and rightly so, a distrust of the medical profession, and most of the time they are not treated with humanity and dignity. But when they see people who look like us, they are expecting a different level of care and a different degree of interaction, and we ought to take the time to do that. I also wanted to ask the NP a while ago, my brother, have you heard of the use of bronchoscopy? It was used by a South African doctor to treat COVID patients, and he has done it so successfully. I do not know if you are doing that, or if your institution has tried it, but I read a study that it was an incredibly successful results in the South African patients. Thank you. I don't want to belabor the point any further.
I don't know that it's practiced across the board in the MICUs, because I'm not in the MICUs currently. When we were doing the COVID patients in the ICU where I work, I don't think we were bronching them then. We do bronch some of our patients who have had COVID and had the lingering respiratory illness, and it over time it is successful when you couple that with just ongoing respiratory care, like lavaging them periodically and things like that. I always thought that it would have probably been, in fact, I would suggest it all the time, if we bronch them and we bronch them with a respiratory antibiotic, instead of just taking the systemic antibiotics. And I heard that there's some practices that do the antibiotic into the respiratory that may have some efficacy, but I couldn't give you stats on.
Well, thank you, Dr. Newton and Dr. And Mr. Ryan, thank you for addressing that question. So lots of great clinical experience you're sharing with us. And Mr. Ryan, I was struck as well that you were able to break through to that patient by speaking in language that he can understand and really speaking to his heart. You talked about his children. And so he was able to give up the fight and say, just do what you need to do to take care of me. So he was willing once you were able to speak to his heart. So next we have Ruth Boucher, who is going to share with us some of her stress management strategies. Ruth, can you speak to some of the things you're doing?
Can you hear me?
Yes, we can.
Okay, great. Good evening. And thank you, Dr. Charmaine and Dr. Dwayne Woode, distinguished panelists. I'm the one with the least letters behind my name here, but I hope to make this next 5 minutes an impact and putting out the awareness that, you know, nurses are the frontline soldiers, the backbone of medicine, the backbone of what we call health care, but really is disease care. And my passion has been for a couple of decades now that I've been a nurse, is to promote nurse health. And so this year that they have named the year of the nurse, I guess because of the COVID virus that has elevated us to the status of some superpower or some super, you know, yeah, so we're supposed to have superpower, but we've been working on the really heavy duties. And I'm not sure if Dr. Davis, during your time, you had that much challenge, as many challenges we have. But I believe that we are the backbone of medicine, of disease care. And it is for us to adopt more self-care practices, because I believe that the health of the patients, the community, the nation, the world depends on nurse health. And we have outnumbered physicians. So no offense, Dr. Woode and the rest of you guys who are physicians out there, but if the nurse is the one to lead us, which I believe, into greater health, because we're the one that have time, well, it has become challenging to teach prevention, and we do know that prevention is key. And there's a greater challenge even when you work in the ICU, like I am an ICU nurse, okay? But we do well teaching prevention, and we need to be more accountable for our own health. I believe that self-care should be first, nurse self-care first. So this is something that I love running and promoting and encouraging my colleagues, my friends, that the challenges are many. And it's because we do go to the hospital, we work, but our job doesn't end there. The community, our family, our friends call on us often, and we don't really find time to take care of ourselves. And I think that this is where the root of the problem is, that if the institutions will have some little compassion on nurses, and not just say, oh, superheroes work here, but provide for us some sort of framework, some relief from the stress that we suffer from day to day, and we often suffer with it in silence. And some of you may know that I have been through burnout. Burnout is an ugly ordeal. I don't think anyone, especially a nurse, should be suffering from such a thing, but because we have made it some sort of religion that our help comes after everybody else's, our needs. This has been a major problem, and it needs to, we need some relief from this, First of all, I believe a nurse should have the mindset of self-care first. You have to put on your own oxygen. And when you do that, it's a hard thing to do because the indoctrination has been pretty deep, okay? But if we put on our oxygen first, then we can help people thrive. We can help our patients. So there has been some of my friends, let's say, would not work in the South because some places are harder to work as a nurse than other places. For instance, we know that California, they have this mandate that nurses have to take 2 15-minute break and 1 30-minute break if you work a 12-hour shift. In the South, you're lucky if you get to have a 15-minute break. And if you do, and the patients call, you have to go out and leave your plate. That should not be so. Everybody else gets an hour break, but the nurse, who spends most of her time trying to keep your patient and patients and their family alive is not allowed, humane action as going to the bathroom or eating her meal in peace, if she gets a meal, that is. So my challenge to all of you nurses out there is that nothing will change unless you change. And you have to find a greater reason of why you need to stop and assess what it is that you need to stay healthy, whether that is eating wholesome nutrition, as some of the panelists mentioned, getting some sunshine, or taking your vitamin D supplements, taking a meditation course, or some sort of, having some sort of getaway so that you can relieve your stress. You need to determine that. So find a why. Choose some of the challenges, the practices that you need to incorporate in your daily life, and then stick with it. You don't have to go and run a marathon like I do, or anything less than that. Just the fact that, let's say you determine you're gonna keep your body healthier, take a 10-minute break 3 times a day and get some physical activity in, because even little changes amount to big things. Okay, so I don't want to take any more time because I was late on the scene, but I want to encourage you that unless you take matters into your own hand, your health, no one else is there for you. And I'm saying that because I have been through nursing burnout, and it's an ugly ordeal to go through. And I have figured out for myself that this thing happens because we lack self-care. I've noticed it in nurses, and it is an ugly thing to see. So is the compassion fatigue, which is uglier. I mean, you think you burn out. Those people, it's just charcoal coming into work, all right? Be real. So, and then there's the increased incidence of suicide. I just want you to, consider that you are human. You deserve to take care of yourself, and don't feel guilty. This is something that we feel guilty, going to the bathroom, but the patient needs his pain medicine. You know what I mean? And you feel guilty if you go and relieve yourself first. And this needs to change. I think that we can be the leaders at the forefront of health, making a real change in the lives of others if we practice greater self-care. And this is all I have to say. Thank you for giving me the time. Appreciate it, Dr. Woode.
Thank you, Ruth, for sharing that with us. And I truly hope that our listening audience, particularly our nurses, take what you said to heart in prioritizing their own self-care. We have one more panelist. This is Miss Jodelle Callens, who has been an LPN for 7 years. She works in Birmingham, Alabama. And Jodelle had experience with contracting COVID-19 back in the summer. Jodelle, can you share with us how it was that you contracted COVID-19? Do you know how you got it?
Not exactly. More than likely, for my job, at the time I was working at a nursing home, and we had a few cases in the building. So more than likely, that's where it happened.
Okay, all right. So, we've heard descriptions of what happens when someone becomes infected. Can you tell us a little bit about your symptoms, what you experienced, and how you felt during the time that you had the active infection?
Well, the first thing that I have to say is that I was also pregnant at the time. So, sometimes you overlook stuff and associate it with other things. So I can remember having like a chronic headache or whatever before they tested us, and we were testing twice a week at work or whatever. But that's the only thing that kind of stood out to me was a headache. And once they gave me my results, and then everything else came. So it was a headache, sniffles. I can remember just feeling extremely weak, fatigued. I laid in bed like at least 3 days, and that's not like me. Um, um, and when I did have the energy or the strength to move around, then of course, there was weakness in my legs, and then I was short of breath. And so, I'm 35, energetic. I've never experienced anything like that. It it surprised me, because I consider myself somewhat healthy, but yeah, it's real.
Okay, all right. So how long did your symptoms last approximately?
Um, at least 7 days.
Okay, okay, okay. And would you consider that your case was mild, moderate, or severe? How would you categorize it?
Probably mild. I had a coworker that ended up in the hospital on one of those machines. So you know, she
Okay,
she got it. She got it like maybe she was one of the first ones to get it in at the job, and she actually went to the hospital. So
okay. So it sounds like there were several of the workers who contracted the COVID-19 and were symptomatic. This was all about the same time, or this was over a
no,
long period of time.
it just kind of came through like a wave. Like I said, we were testing residents once a week, employees twice a week. So this week it might be a batch of 4 or 5 employees. At first, nobody was positive. Um, nobody was, and that went on for like maybe 2 or 3 weeks, and then we started coming back with positive employees. It was like maybe 3 or 4 here and there, and then it just kind of came through like a wave throughout the building.
Mm. Okay, okay, okay. All right. So, can you share with us the impact of having had COVID-19? Um, you know, I've not had it. Thank God. I know people who have had it and who have survived. I know, people who have had it and ultimately, did not survive it. Tell me how has it impacted your life having now you can say you're a survivor having had COVID-19 and recovered.
I mean, it definitely was an eye opener. It it causes you to have more compassion. Like I just came home from working the COVID unit at work, and you have some residents there. They will eat. I had one resident. She only thing she would respond to was her name. She wouldn't eat anything. Couldn't give her any medicine. She's just kind of there. Um, her appetite was gone. And it's you have to you have to just kind of take your time with them. A lot of people. I guess I'm less frightened about it because I've had it already. So they say once you've had it before, the next time around, if you get it again, it won't be as bad or whatever. So you just have to kind of nursing already requires compassion, but with COVID, you know, you just really have to. I don't know. I don't have the words, but it's a shame how the older people with their comorbidities, it just kind of it doesn't do them right at all. So you just have to be patient and kind and do whatever you can. Think ahead. Don't just kind of sit around and let them just see what happens. Try to see what you can prevent. Work around certain things.
Okay. Okay. So it sounds like it's actually made you a better nurse. Would you agree?
You can say that. You can say that.
Okay, all right. Well, thank you, Jodelle. I know you've had a full day, and I know that this is not the best time for you in terms of other life events. You've had some grief that you're dealing with, and we just appreciate your willingness to come on and share with us your experience. So thank you once again, and I'll talk to you soon.
For having me.
Okay.
All right.
Thank you. Thank you. All right. Well, we've thoroughly enjoyed our panelists. Thank you all for coming. What you've had to share with us has been very impactful. Dr. Davis sharing some of those practical or natural immune boosting strategies that she employs and encourages her patients to use. Ruth sharing the whole idea of self-care, and nurses, in order to take care of others, you need to really prioritize taking care of yourself. The old concept of putting your oxygen on first. And, Mr. Ryan just sharing from the perspective of a nurse practitioner who sees the sickest of the sick, really sharing those insights, and also touching on compassion and really speaking to patients' hearts to get them to help you take care of them. And Dr. Newton, you shared with us the 7 S's. Thank you for that. And I truly hope our listening audience, our viewing audience has, hope you guys have been taking notes. Hope that what has been shared has been helpful to you as you move forward and continue in your careers, being on the front line during this COVID-19 pandemic. So I want to thank our panelists. As we wrap up our program this evening, we just want to take another look at some of our winners. I said last night, I love giving away gifts. Some of you have registered, and so you've been qualified to be put in the drawing for the gifts. Some of you have done a lot of commenting, and we appreciate the engagement. Just to take a look at our winners over the last few days. We had Rhonda B on Wednesday evening, who took away the $50 spa wellness gift card. On Thursday, we had Althea M and Monica W, another gift card and a bottle of the Immune Boost. Friday, we had the Oxygen Sleep Support, and that went to Althea M again and Janice W. And then on last night, we had up for grabs the nursing self-care module that from the program that Ruth has implemented to help other nurses experiencing burnout, and the bottle of the Oxygen Immune Boost. And those go to Sheila D and Loida W. So if you participated in our challenge and were fortunate or blessed enough to win a prize, we will be contacting you in the days ahead to get your prize to you. So congratulations to our winners. If you are a winner and you're listening and you're watching, go ahead and put "I'm a winner" in the chat. Let's see if you're here. Put "I'm a winner" in the chat. I'm a winner in the chat. All right. So we want to thank our sponsors once again for this challenge. Our primary sponsor was Ruth Boucher of The Running Nurse, and she helped us put this program on. Ruth was one of our panelists this evening, and I'm going to give her just another couple of minutes for her just to share a little bit about her program. Ruth, can you take 1 minute?
1 minute. It will be 1 minute.
Can you do it in 1 minute?
I can do it in 1 minute. Well, when we look at the state of nurse health, and you only have to look up the Harvard Nurse Health Report. And in November, there was a paper by it was called "Leading in Times of Crisis," inspired by inspired nurse leaders who did a survey, and 61% of nurses have emotional and physical fatigue. I'm sure that number is probably much higher. My course is basically entitled "From Nursing Burnout to Supercharged Self-Care. Reclaim Your Energy and Ignite Your Life in 6 weeks." It's 6 modules. The first module ought to lift you up from your seat because it is entitled "Go Mad." But don't go mad and go quit your job right now, okay? That would be madness, and we're not into that. So that it is a holistic lifestyle program, and you will be happy that you have given it the chance, to help yourself during this time with such unconventional ways of dealing with nursing burnout. Thank you.
Okay. Thank you, Ruth, for just giving us just a quick snippet, just a quick preview of what someone can expect if they choose to enroll in your program. And thank you once again for being on our panel, and thank you for just supporting this challenge that we've had over the last few days. If you registered for the challenge, you will receive a PDF with some strategies, some that you've heard mentioned during the last 5 days to help boost your immune system. There's also a tracker where you can record your activities, you can track your progress. We want to hear from you about this. We want you to commit, and the tracker is an accountability tool that's going to help you keep your commitment. But we want to hear about it. So reach out to us. You can reach out to us on the Facebook page, Team Destiny Events, and let us know how you're doing. We want to keep up with you, so just let us know how you're doing. So as we bring our evening to a close, our challenge to a close, I've had a great time this week being your host for this event. I personally have benefited from a lot of the information that has been shared. We do hope that in the near future, we will meet again in this forum, have another challenge. So keep on the lookout. To receive notifications, be sure you like and follow our Facebook page, Team Destiny Events. And whenever we have something coming up, then you'll receive a notification regarding that. So we want to say thank you again. And as we close out this evening, I want to leave you with the words of an old Irish proverb. And it goes, "May the road rise to meet you. May the wind be always at your back. May the sun shine warm on your face. May the rain fall softly on your fields. And until we meet again, may God hold you in the palm of his hand." Thank you all once again. Good night and take good care.